Good morning. My name is Sarah Levy-McLeod. I'll be your moderator for today. First up, we have Minister Glavine, who's going to make a quick statement and take some questions. I just want to give a quick reminder to the media on the line. You'll get one question and one follow-up, and I will call your name. Minister, if you'd like to go ahead.
Thank you very much, Sarah. And I must say right off the top, I'm pretty disappointed that Jean LaRoche and Brian Flynn aren't here today because they've been asking me about my future for quite a number of months and years in some cases. And I'm pretty sure Brian and Jean were here when I first came to the legislature in 2003. So today I am officially announcing that I will be retiring from active elected political life when the term is up. I certainly plan to put my heart and soul into the next number of months. The Premier called upon me to fill the role of Minister of Health, which I will certainly do certainly till February 6th, and maybe the new Premier will ask me to carry on, which I would certainly be honored to do, as tough a job as it is. So to be in elected political life for almost 18 years, by the time we get to the next election, it's a great honor. To be able to serve my riding first and then go to government and serve the province, and you also serve the province when you're in opposition, certainly as well. So it's obviously a bit of an emotional day, and you know, to put the kind of time in to elected office that is required today. Certainly my first thanks go to my wife Doris and my family, and probably the biggest reason of all at this stage of my life to head back to private life and enjoy what the Valley has to offer and what our province has to offer. And of course, one of the greatest gifts is to have grandchildren that I'll be able to spend more time with. In some ways, I can't really reoffer anyway, because my long-serving and suffering campaign chair, John Pierce, actually burnt my signs after the last election. So he said, look, 5 elections is just a limit for me. But it's been wonderful to serve the people of Kings West, and I always am reminded that politics is the ultimate in the team game. You could never get here on your own. I've had a wonderful team in Kings West to support me, not just through the 5 elections, but an executive to sit down and discuss the political issues of the day. I've had that good fortune to have a number of people who've been a wonderful sounding board during my time in office. And you know, I've had you know, the good fortune to come into political life with Premier McNeil. We arrived here in 2003. We're the only 2 remaining from the class of 2003, so maybe quite appropriate that as he leaves political office, I leave as well. But I don't want to leave that comment hanging there because, you know, the 3 candidates that where we will select our leader and premier from are exceptional people, and will give, again, great leadership to the province of Nova Scotia, whoever is selected on February 6th. You know, to have the opportunity to be a Minister of Health for the entire first term, you know, to work on the health accord, to bring the province into a coordinated and integrated one healthcare system, that, in my view, really showed its enormous strength through COVID-19, and we continue that journey, and we've had an exceptional to public office, yes, from the teaching profession, but a very ordinary Nova Scotian who felt that I could come here to Province House, to be in opposition at first, to go to government and do the best work possible. There are no perfect answers and solutions to all problems, but to get up each day and face what's on the plate of the province while a task has for me been a joy. And while there are lots of challenging and stressful moments, I have not missed a day of work in my 17 and a half years in political office. So I've enjoyed the journey, and I look forward now to the next stage of my life and the involvements that it will bring. And I'd just like to close on a note that is very important to me, and that is, I came here to show respect for government process, to work with an extraordinary group of civil servants and MLAs from all parties across 17 and a half years that I showed respect for, worked with, and probably, maybe only leave with security having been my only enemy for perhaps parking in the wrong place or parking without notification of a new license plate. But I guess those are minor in the big scheme of things. So with that, as my colleague said, he'll never be able to say it in a very short manner.
Thank you, Minister. I'm going to open the line for questions. Just a reminder for media on the line, you will get one question and one follow-up. Anyone who isn't asking a question, please make sure your line is on mute. Thank you. Going to start with Jean Laroche from CBC.
Mr. Levine, wow. I can confirm I was there when you walked in the door. Good luck to you. Meantime, if we get to some business, you met recently with the people responsible for Tenera Care, and they brought to you a proposal for their particular device to be able to track long-term care seniors and others in their homes. Could you tell me what you plan to do with that proposal, or whether you plan to go ahead?
Well, I can confirm that myself and the Deputy Oral were very impressed, with the system. We also had Vicky Elliott Lopez. We had her take a look at it actually in operation. So we've started to take a look at this system, and it'll be take us a little while to take a look at what steps we will take in the future in regards to an innovative, a Nova Scotia product that I believe can make our nursing homes safer.
Jean Laroche, you can go ahead with your follow-up.
All right, Minister, on a completely different topic, what's your understanding of when there is a vaccine for coronavirus, how it will roll out, and what the pecking order will be for people getting that shot?
Well, that really was a topic this week in the FPT meeting. And with the uncertainties around when Health Canada will approve a vaccine or a number of vaccines, it's still very early days. I know Everybody is anticipating, a priority list. It's an area that, in fact, the Premier has a dedicated conversation today with the Prime Minister and First Ministers. So we'll probably know more in the next few days as to how that will roll out.
Next, I'd like to go to Brian Flynn from allnovascotia.com. Brian, go ahead with your question.
Thanks, Sarah. Minister, I just want to say at the beginning of this, congratulations on your retirement and at nursing homes still allowed to work in multiple homes the way they were at the start of the spring outbreak?
I'll have to get a final picture on that across the province. I know that we want a dedicated staff in each home, but sometimes there are short positions. So I'll have to find that out for you. What I'm very pleased about is that the assistants that were put in place during COVID to take some pressure, especially off CCAs. Those assistants will be in place until March the 31st. And then we'll take a look at their need in nursing homes. So I feel at the moment our nursing homes are well staffed, and I will find out for you if there are any nursing homes that would have staff working in 2 facilities.
Brian, you can go ahead with your follow-up.
Thanks. Minister, I also want to ask a bit about hospital capacity. Obviously, there is no surge of COVID-19 patients going into hospitals at this time, but what's being done to prepare hospitals in case we get to that point this fall?
Yes, I would say that, through the summer months in particular, to the credit of the medical teams across the province with the backlog of surgeries, we're working full out. But as we moved into fall, in anticipation that there could be some degree of surge in our province, we are currently at 90% capacity in our hospitals across the province and 75% in our ICUs. So we have that ability to move very quickly to look after any serious COVID patient.
Next, we'll go to Lindsay Armstrong from allnovascotia.com. Go ahead, Lindsay.
Thank you. Looking back at vaccines again, I understand you said we're at preliminary stages, and Dr. Strang said Friday there's no certainty around the amount of vaccine doses. I'd like to know how many doses the Department of Health is expecting to ensure our province has adequate access.
So I would leave that really to Dr. Strang. We have a very strong vaccination, immunization team in the province. We're a leader in the country on distribution of flu vaccine with the number of Nova Scotians that get a vaccination every year. In my first conversations, we were certainly working on a per capita basis, but there are still some unknowns in terms of a priority list. And those are the deep discussions of our provincial chief medical officers in the coming days, along with Premier McNeil and First Ministers, as to what will be that list and the first numbers that will come to the province. One of the good things that's happening at the Department of Health is the coordination now of a large number of groups that would be involved, and we'll certainly be ready when Health Canada and the federal government procurement starts to move out to the province.
Lindsay, you can go ahead with your follow-up.
Thank you. Regarding testing capacity, Dr. Strang said that mid-November would mark 2,500 tests a day, and even with this surplus of bar staff and patrons that have volunteered to test, the province is still hitting just around 1,500 tests a day. Why haven't we reached that level yet?
You know, that sometimes can be a product of, you know, the entry and data collection. And I know we're continuing to add the number of tests per day now. We're also doing the rapid tests, and I do give a great deal of credit to our students who've been kind of targeted a bit in that 18 to 35 year old that may be you know, congregating more than what they should, but at the same time you know, about 4,000 have lined up to get the rapid test, which can be that first indicator that they would need the lab test as well. So, you know, while we're still on the journey towards 2,500, I think we will be able to reach that goal.
Thanks, Minister. Next, we're going to go to Mike Gorman from CBC. Go ahead, Mike.
Thanks, Minister. Congratulations on retirement. Minister, earlier this week you announced designated transfer vehicles for EHS, and I wonder, first of all, what it is you were seeing in the system that has brought you to the point where you decided that was a requirement.
Thank you very much, Mike, and I must say these days it's far from retirement with all that's on our plate at the Department of Health, but I thank you for your comment. You know, during, in fact, it was really during my my years as minister and follow-up with Minister Delory and, you know, his observations and what we would hear from the public of Nova Scotia, you know, and I felt that, you know, with having, you know, one of the top 3 or 4 paramedic services in North America, that we needed them to be available for the most serious of accidents and medical traumas that occur each day in our province. And here they were taking a person to dialysis, taking a very mobile person from assisted living, you know, for an X-ray or some other procedure. So I feel that we can safely have another level of transporting those who are in a position where they would certainly need, you know, transportation. And I feel this will serve that purpose very, very well. We'll start off with the Central Zone, Kentville and Bridgewater, and I think we will learn from those pilots very quickly that this is going to be a wonderful back service to the ambulatory service that we have in the province.
Mike, you can go ahead with your follow-up.
Thanks. And Minister, on the issue of location, as you say, there are only 3 at the moment. None of them are north of Halifax. The most recent high-profile transfer issue we had was in Amherst. Why not have a van set up for Cape Breton and somewhere else between the island and Halifax?
Yeah, no, it's a great question, Mike, and you know, we will get, I'm sure, feedback, you know, in the coming months, and you know, we're still in the process of working on our next Medivie, you know, EHS contract, and we'll see where that goes. And I'm sure other needs will be pointed out, but we want to make sure we have learnings from those pilot areas, and then extend it across the province.
Next, we'll go to Elizabeth McSheffrey from Global News. Elizabeth, go ahead.
Hi, Minister. I'm wondering if, as we head into a second wave, there's any plan to renew the pandemic bonus for frontline workers under the Essential Healthcare Workers Program?
Could you repeat that, please? I missed a part of it.
Is there any plan to renew the pandemic bonus for frontline workers under the Essential Healthcare Workers Program?
That really at this stage would come from I believe the federal government. Look, I profoundly believe in listening to Dr. Strang and public health as I'm back into the department. Nova Scotians are stepping up, carrying out the protocols. And I believe we can flatten this second curve that's coming at us here, and that we can again, be the leader in Canada in dealing with COVID-19. I think even though we may say it's only been a year in the making, there's every indication of some long-term impacts of COVID, and so prevention is a key. And doing those basic protocols, we have to get the mask on. We have to keep our distance. Those are essential. And for the common good of Nova Scotia and to lead the country in best practice, I think we're going to see us now step back to the great job that we did in the first round.
Elizabeth, you can go ahead with your follow-up.
I'd like to ask a question about long-term care. In the first wave, we saw a situation where the province took away, emergency visitation for long-term care homes, but didn't have the legal authority to order long-term care homes to reinstate visitation, even when the province loosened its restrictions there. I wonder if you're having any conversations with long-term care home administrators about that as we're in a second wave, and whether you're hoping to avoid a duplication of that experience many families had the first time around.
So I guess the way that I look at our nursing home situation is that they are certainly our most frail and vulnerable citizens with COVID, and taking a very strong precautionary approach to limit the number of visitors and to still allow, however, caregivers and support for those in long-term care. We're going to maintain that. We're also going to be testing, staff. We just want to keep it out of all of our nursing homes, keep them safe through this next period, and hopefully we'll get to the day of a vaccine and to give them the full protection on a global pandemic that is been very costly in human life, and 80% of all deaths in Canada in our nursing homes. Stepping up here and doing the right thing is what we must continue.
Next, we'll go to Tim Bousquet with the Halifax Examiner. Tim, you can go ahead.
Hi, Minister. As we're moving into the second wave here, are the rapid COVID tests, will they be made available for nursing home staff and their residents?
So that the plan is to roll this out, and again get it into to nursing homes, so that staff can be tested on a regular basis. We know that the asymptomatic carrier was the problem in the first wave. Nursing home staff, if sick, would stay at home, but asymptomatic can bring it in, and we need to do that rapid testing. We have a large supply, and we're going to put them to use as that first line of defense.
Tim, go ahead with your follow-up.
Yeah, you just spoke to the long-term effects of COVID, which are the so-called long haulers. But the long haulers tell us that the provincial health system doesn't even acknowledge their existence. No one is studying them. There's no long-term care options available to them. What would you say to them?
I believe we're still, early days. There is certainly research beyond Nova Scotia and beyond Canada that I am certain that our public health and perhaps, health departments and ministry will have an opportunity in the future to know what those impacts are and the kind of medical support that they will need. We don't want to leave them without care. But it's early days. We're dealing with the most challenging aspects now of the second wave.
And finally, we'll go to Andrew Rankin from the Chronicle Herald.
Congratulations, Minister, on your retirement. I just wanted to ask about flu vaccine. There's been some flu vaccine shortages in recent years, so I'm just wondering why should Nova Scotians be confident the province will get an ample fair share of supply of COVID vaccine?
Even though we have a Liberal, Prime Minister in Ottawa, our Premier will be as tough as any First Minister in demanding that we have a fair share. And I'm certainly very, very proud of the fact that being part of a healthcare system that delivers the highest percentage of residents that get a flu vaccine each year, and it proved during H1N1 again that we were really the envy of the country, but it comes to that precautionary and advanced work that is being done. I feel when it comes to the vaccine, I'll certainly have a loud voice at the FPT table to work with what is fair for Nova Scotia.
Andrew, you can go ahead with your follow-up.
Dr. Strang has pointed to concerns about excessive drinking among 18 to 35-year-olds, and bars have been closed. Given that, do you think that NSLC outlet hours should be reduced as well, as was the case in the initial months of the pandemic?
I believe we've learned a great deal from the first wave, and I can see that the approach right now, certainly the number at 37 on Monday or Tuesday was, very, very, I guess, disappointing to see, because it is people that spread the virus. So I think we're taking a measured approach now, maybe not referring to it as kind of that, that circuit breaker. But I believe that, in 2 weeks, we can corral the virus and reduce the number. It won't be easy, but if all Nova Scotians bear down right now, I believe that the new year can look very promising to getting back to the kind of movement that we like to have through all seasons of the year. But Christmas will be different this year. But I think there can also be great positives that come out of that period. I think we'll see over 2 weeks if we need to tighten up further or leave hours at our NSLC as they currently are.
Minister, we're just going to take a couple more. Sorry about that. Can I call on Natasha Pace, please, from CTV?
Thank you. Minister, can you explain why gyms are mandated to close when places like hair salons and spas can remain open? What is behind that particular distinction?
Could you repeat that? I did miss your first little part there.
Yep. Under the new restrictions today, gyms are mandated to close, but hair salons and spas are still open. Why is that?
When it gets down to that, kind of area, I really leave that to, public health and the discernment that they make. And again, is there something about the function of people, movement of people, in a gym versus the sedentary and controlled environment that you would have in a hair salon. I'll leave that one really for public health to explain. And look, I think all of us see that being 100% consistent is very challenging with COVID. The more we learn, the more we know that some practices will change.
Tasha, you can go ahead with your follow-up.
Thank you. Minister, we're hearing from a number of people in HRM that say they have been going outside of the municipality to places like Truro and Bridgewater to get tested for COVID. Why is this happening, and should it be happening?
Well, I believe now that there is a large number at this point in the year where we do pick up the seasonal cold, although flu has been dramatically reduced so far right across the country. I believe that visual of seeing that very, very long lineup over the last few days, have people wondering whether they'd be able to get in a timely fashion, and especially someone who now has 2 or 3 of the symptoms of COVID. They're doing the responsible thing and getting to a site. I'm a believer that we use the entire healthcare delivery system as much as possible. And sometimes, like a pandemic, we may have to look for our neighbor facility to get the test that we need.
Thank you, Minister.
Thank you.
Good morning, everyone. Just before we go to questions, I do want to make a comment about Minister Glavine and his announcement. As he said, he and I came into this business together in 2003. I only knew Leo a little bit, really, by reputation. He was a teacher, a hockey coach, heavily involved in the community, well respected. But I must tell you, over the last 17, 18 years with him, my admiration for him has grown so much. It is tough enough to be in this business, but when you're asked to be the Minister of Health and you're in a position where you're making difficult decisions that aren't always well received by Nova Scotians, the reactions can be difficult and can be hard to hear sometimes. But in my entire time of being associated with Leo, the one consistent thing that has always remained true is what a gentleman he is, and the way he responded, and the kindness, quite frankly, he shows Nova Scotians day in and day out. No matter what would be said about him or to him, he remained the kind, gentle man he is. He is a great role model for anyone who wants to be in elected office. I wish him and Doris well as he enters into what will be, I think, his favorite job of being a grandfather and enjoying his 3 grandgirls, who I know are a big part of his life. But Leo, my friend, this has been a great journey. I don't think either one of us thought we would be doing this for this long. I admire you a great deal, and I wish you nothing but great health and happiness as you head into the next part and the next chapter of your life. and I look forward to continuing to grow our friendship wherever it may take both of us. So congratulations on a tremendous career and being true to who you are as a human being. Happy to take any questions.
Just a reminder, we'll take one question and one follow-up in the time we have. We have 20 minutes for questions. I can just ask everyone again to please mute your line unless you are asking a question. First, I'd like to call on Keith Doucette from Canadian Press. Keith?
Good afternoon, Premier. I want to talk to you about your portfolio involving the Indigenous file and the fishery. We've gotten word, obviously, that DFO has begun lifting traps in St. Mary's Bay. Many might be involved with the Indigenous livelihood fishery there. You've been outspoken about the need to get some kind of an agreement. That fishery has been going on now since September, and we still don't have one, and now they seem to have stepped up enforcement. I'm just wondering what your thoughts are on that, and do you see a possibility with dumping day coming Monday that perhaps there could be a smoothing of the waters and perhaps something done?
Well, I've always believed that all parties had to be at the table to find what was a path forward. If you go back to the Marshall inquiry or Marshall decision, it talks about the right of the Indigenous community, the Mi'kmaq community, for a moderate livelihood. But the second part of that decision said DFO had a responsibility to ensure that it was integrated in a sustainable way in the fishery. That's why I've always believed this was not a discussion that would just be between the Mi'kmaq and the federal government. We needed commercial fishermen at the table as well, because the decision around rights-based had already been decided. The court had already made that decision, and the only thing left to be was how do you integrate that into a fishery that currently exists around stock, the science around that stock, conservation, and in order to do that, all the players have to be at the table. And in that process, once that structure had been put around what a moderate livelihood was there, then it will be up to DFO to enforce the rules and regulations around that fishery.
Keith, you can go ahead with your follow-up.
Okay, unrelated issue. Yesterday there was a major policy announcement, a bit of a departure from your view on controls around rent. I'm wondering, with the high-profile evictions that we've heard about in Halifax, can they end without rent control for at least a few more years, if not more? I mean, why in fact did you make this major policy change, given your stance before?
Yeah, well, if you go back and look at the growth of our economy in the last 5 years, listen, on every measure prior to COVID, this economy was on fire. Population was growing at an all-time high, unemployment at an all-time low, businesses was moving. We were seeing people wanting to come live, and particularly in the downtown peninsula core here and surrounding areas in HRM, which put a tremendous amount of pressure on the rent availability. We've been hearing some stories and seeing cases where people were being evicted as investments were being made into those properties. It became apparent there needed to be a moment in time here where we needed to be able to have an assessment, bring our partners together. I think the important piece of yesterday was there was a cooling down here of at the growth of rents in here, but also the minister put together a panel that will bring back recommendations to a future government about how do we ensure that the private sector can continue to operate and make investments in communities across this province. At the same time, though, that we have an affordable housing market in Nova Scotia. So the decision yesterday, leading into that, there was a lot of work going into that with the Minister's Department, and that's why that decision was made yesterday.
Next, we'll go to Natasha Pace from CTV. Natasha, go ahead with your question.
Thank you. Premier, we're hearing from some people who say they live in HRM but have gone outside the central zone to get tested for COVID-19. Is that something you're recommending people do? Are there some concerns around that, especially with the new restrictions in place?
Oh, they would be. It would be suggested to them where they should be going to get their tests. Some people are choosing to go in other places. The mobility of our citizens coming and going. Lots of people come into HRM, for example, to go to work, their workplace here. When you've seen some of those alerts, so they're being tested in here, even though they may not live in HRM. There's others who live outside, head in the other direction. Some make that choice simply because they may live on the outskirts of the city and it's easier to go out for that testing. We have one integrated healthcare system. It's one of the issues that we were doing, and one of the reasons why in this round we haven't closed the Atlantic bubble. We haven't closed simply because our healthcare system is still functioning, to really full capacity. And the biggest thing for us really is to make sure that those who need a test get a test. That's really the issue. We haven't seen, and I haven't heard of a great number of people, for example, leaving HRM to go to other parts of the province, but I'm sure some are doing it.
Tasha, you can go ahead with your follow-up.
Thank you. I just wanted to ask you about Nova Scotia having access to the COVID vaccine. Do you think we will be at the back of the line because of our success here in the province?
No, I think the national government will roll this out across the country. On we're looking, as we do most of our programs, they start out on a per capita basis. This thing we've been working with. I think the bigger question should be, and it would be my advice to the national government to lay out who gets the vaccine first, what are the categories that would be there. That should be rolled out nationally. As you know, more so of an issue in Western Canada, where you'd have, provincial borders running through towns, but you don't want a situation where in one community we're vaccinating a certain population and then another they can't get it. We looked at the science, we work with public health, our public health officials here, and they should prioritize who gets that vaccine.
Next
we'll distribute it, administer it, and deal with all of that. But there should be, in my view, a national protocol about who gets it.
Next, we'll go to Jean Laroche from CBC.
Good afternoon, Premier. As you know, the Liberals are now ready to have committees continue even after prorogation and even virtually. That did not happen in the spring. I just wondered what changed.
Well, this is very different. When it came into the spring, we were grappling with this unprecedented pandemic for our province. There were many things we didn't know about what was going to happen and what had been happening. I think it's fair to say we had seen what was happening around the world in countries, the amount of crippling of healthcare systems, all of that was really our focus. And now in this second wave, we're opening up our economy gradually. And when we see an issue where we have an outbreak somewhere, that we can actually isolate that particular community or school to bring it down, then that way we won't have to do the overall shutdown like we did in the spring, and that's going to be continued to be our goal. And if you go back to the resolution that Minister McClellan brought in, it was actually focused on if the House was prorogued that these committees would be able to continue. That was back in 2017. They were always going to continue, and the committees themselves will make the decision on how they're going to meet. But I think Dr. Strang, with the 5-person rule, makes it obvious that they can't meet in person. There was a bit of confusion over that. I'm not sure whether the opposition who had been asking for these were opposed to doing that, but then again, there you have it.
Jean, go ahead with your follow-up.
I just want to follow up on the rent control. Have you personally changed your mind on rent control? Do you think that they do now work?
We have a situation where, in this province, where our economy, as I said, many of you found that comment that I said a week ago amusing. The reality of it is our economy was on fire. Investments were happening. People were moving here from all around the world. It put a tremendous amount of pressure on the housing market. It's my personal view that in the long run, rent control does not work. But we knew we had to do something at this moment in time. What the minister has brought out is an opportunity for all sides of the housing market in this province to come together in this committee to look at what is the long-term solution as we continue to march towards 1 million people in this province, as we continue to open up our economy to more young people. We're seeing our university graduates staying here, working here because of the changes we've made in the economy. That will continue. If If the policies that have been in place for the last 5 years continue to be implemented, I think we'll continue to see a positive economic future for this province. And in order to do that, we have to make sure that the housing market has a level of affordability in it that can allow people to live where they want to live in this province.
Next, we'll go to Brian Flynn from allnovascotia.com. Brian?
Thank you. Premier, a colleague and I took a stab at compiling a list of stimulus projects following the suggestion you gave at a cabinet meeting that we should compare the capital plan with the tender site. But we only managed to come up with projects worth a little over $60 million, which is about a quarter of the value of the program. And we were told by staff that some of the spending doesn't appear as distinct contracts on that tender site. So since the information isn't quite so readily available, will the government release the lists of stimulus program projects?
Every tender that is awarded in this province is listed. It's out there to see. The idea that somehow they're being hidden is just a ridiculous notion. I recognize the opposition have a role to play, and they looking for headline and news, but I don't know how more transparent you can be than putting them on a website for every tender that is out there. I did have a quick glance at your article. I do appreciate the fact that you at least recognize the tenders that are going out there are being spread out across the province, not in a political way, but in a way to get people to work. And that's in essence what we were doing. And we'll continue to do that, and that will be our focus. But I would encourage you and all Nova Scotians who want to recognize where that money is being spent, there's that tender website.
Brian, you can go ahead with your follow-up.
Sure, thanks. Yeah, well, Premier, just to clarify, there's really no way to tell which tenders on that site are stimulus. I guess is what I'm trying to get at, and some other of those stimulus tenders actually appear on the alternate procurement website. They're not apparently they weren't tendered. So yeah, I'm just trying to get some sense. Will Nova Scotians ever be able to tell exactly where that $228 million that you announced went?
They'll certainly be able to see where the $1 billion in infrastructure money went. It's what we're spending. It's on that website when it all goes out. I don't know how much more transparent I can be, other than unless you want me to go down and identify every program that the money has come out of. I don't think Nova Scotians think that's the best use of the Premier's time. I think they want me to actually focus to try to create jobs and create economic opportunities. This is, quite frankly, people looking for something to complain about. Nova Scotians who are working are grateful and thankful. And it's been distributed across the province and put in infrastructure that'll be there to help us find our way out of this pandemic when it comes, and that's where I'll continue to stay focused on that. And those who want to write their stories or try to put a press release out complaining about the fact that they want the Premier wasting their time of trying to identify where these projects are, I'll give it as much thought as I have up to this point.
Next, we'll go to Elizabeth McSheffrey from Global News.
Hi, Premier. We know in Newfoundland at the start of the pandemic, there was a ban on non-essential travel coming in and out of the province. I wonder if that was ever a discussion in Nova Scotia, and if there's a possibility that that discussion is being renewed in a second wave. Are those conversations happening at all?
So Newfoundland and Prince Edward Island have brought in place where they've gone back to really, if you are coming from outside of their particular province from anywhere, you have to isolate for the 14 days. We have not done that. What we're focused on really, though, Dr. Strang's been really clear about non-essential travel. That would be true within inside of our province, but it's also, we would say that about people coming from outside in. One of the reasons at this point, as I said earlier, we have kept our healthcare system functioning. As you remember, in the first wave, we reduced it down to about 70%. A lot of elective surgeries are canceled. A lot of appointments to specialists were canceled. As you know, we're the home of the IWK regional hospital here. It really was to allow the continued integration of that service with their sister province next door. A number of people in Amherst would, in that area, northern, would end up going into New Brunswick for some healthcare services. Same issue would come, New Brunswickers coming into Amherst. So the message has been really clear. If you don't need to travel, don't. But if it's an essential service you get, you can come in and not have to do that, the isolation inside of that Atlantic bubble model.
Elizabeth, you can go ahead with your follow-up.
I wonder, Premier, what you will be advocating for at today's First Minister meeting on the vaccine, and whether you support calls for a national framework for cracking down on the pandemic.
Well, as I said earlier, I think what the national government should do is lay out the criteria of who should receive this vaccine first, whether it is those in long-term care facilities, whether it's healthcare workers, people with underlying health conditions. They should lay out that standard, and it should be a national standard. In terms of distributing it and providing or giving it, we will, as a province, are doing that. I can tell you, we have, as we did around the PPE, we have a committee that's a cross-government committee that ensures that we have the appropriate infrastructure in place. We're not waiting for the federal government to, for example, we're looking to make sure we have the appropriate freezers that we require, the extra supplies that would be required, whether it's syringes, swabs, making sure that they're all in place, and so that when a vaccine is actually authorized to be able to be used in this country, then we will be ready and up and going. So the very things that we can control as a government and as a province are well on their way, and you know, my voice will join many of the national premiers who believe the federal government should lay out the criteria of who and when people would receive that.
Next we'll go to Tim Bousquet from the Halifax Examiner. Tim, go ahead.
Hi, Premier. You've tied the rental cap to the state of emergency, which hopefully will only last a few months more. We all hope, I think. Do you think that after the emergency is lifted, something fundamentally will change, that suddenly renters will be better able to afford rent increases?
No, I think obviously we believe that that state of emergency will be in place for quite some time. You know, let's be clear: there is no vaccine that's been approved. You know, there's lots of talk about that. Bearing in mind that when one is approved, there will be a global supply required. Bearing in mind it will take some time to make sure that we can vaccinate all of our global citizens. So the idea that all of a sudden the panacea will be here when the vaccine shows up and everything's going to go back to a level of normalcy right away, it's just nonsensical, and that'll be in place. And then, as you know, as I said, part of the minister's announcement yesterday was the issue of the committee that would go together. I'm sure they will make ongoing recommendations through that process, but the new government then will make a decision on the direction in terms of rent control.
Tim, you can go ahead with your follow-up.
Yeah, I guess I wasn't asking so much about the vaccine, but the issue of rentals, and I think fundamentally it's that rents have been going up more than wages. And do you see that equation changing at some point in the future, that wages will go up faster than rents?
Well, actually, we've had tremendous wage growth in our province. If you go back and have a look, in 2013, private sector wage growth was actually, at one point, we were leading the country in some months. But listen, there's no question there's been a tremendous pressure on housing stock in our province. I made this comment to you the other day. Much of this is related to the economic growth of this province and the population growth and the demand and supply. That's the issue that will have to be dealt with. That's what that committee is going to be dealing with, and they will bring out recommendations. What the minister did yesterday in conjunction with his colleagues was lay out a path to look at what is a long-term strategy around affordable housing. And you know, there are those who believe rent control should be in place forever. I'm not one of those, but I do believe, and I did recognize that something had to come into play at this moment in time, and we laid out that plan yesterday.
Next we'll go to Mike Gorman with CBC. Mike?
Thanks. Thank you. Premier, sticking with that point for a moment, housing advocates and the opposition and other people would argue that the very point you and Minister Porter have made for why you did what you did yesterday has been plainly obvious in this city for the better part of the last 2 years. Are you concerned that taking as long as you have to make this change has unnecessarily forced a whole lot of people out of their apartments who otherwise could still be in them?
Listen, every time we make a decision, people, always say it could be sooner. Why didn't we do something before? Why didn't we anticipate this happening? The reality of it is the minister responded yesterday. It's retroactive back to September. We're continuing to work with our communities, and we'll continue to work with our partners to deal with the issue of affordability and housing.
Mike, you can go ahead with your follow-up.
Thank you. I'd like to return to the stimulus for a moment. Please don't take this as coming off as flippant, sir, but I don't think anybody is suggesting that you find the information and provide it to us. I made the same request that Brian did, and it was to TIR officials whose job it is to track this stuff. We were told we could have it, and then that decision was reversed. And I wonder why there seems to be such an opposition from your office to make plain to Nova Scotians how their money is being spent, beyond them simply driving around and trying to determine what bridges have been repaired and what roads have been paved.
Well, first of all, it's not my office. Our government has had a policy to post every awarded tender. They're posted. You can look it up. I don't know what more you want. They're there. To suggest you're not getting them is just not accurate. You're like every other Nova Scotian. They're on the website. Go look at them. We haven't released tenders that haven't been awarded. Once it's awarded, they go out, and they're there.
Finally, we'll go to Andrew Rankin from the Chronicle Herald. Andrew?
Hi, Premier. There's been a huge spike in homelessness and HRM, and you're urging people to stay home. So I'm wondering what the province's plan is to make sure these people get housed while we're in a state of emergency with cases of COVID spiking and winter right here.
The minister announced yesterday there was funding for homeless shelters. We continue to work with our partners to provide that support.
Andrew, go ahead with your follow-up.
Yeah, well, Nova Scotia, is behind all but one province in securing contact tracers from the federal government. Can you explain what was the delay there, and do you think that lag might have contributed to the spread we're seeing now?
No, not at all, Andrew. I'm sure you follow the news nationally. There's been major outbreaks in other parts of the Canadian Federation. Many of them required the national government to step in when it came to contact tracing. We've had plenty of support here with contact tracing. The federal government was coming in into provinces that were in desperate need of that. And when we needed it, we followed through it and continued, and it'll be there if required. But it has nothing to do with this current situation. The reality of it is we have this virus that has come in to our province that has been